In all the years that I've had MS, and in all the neurologists that have treated me, and all the MRI scans that I've had, it was only maybe a year ago that I finally had an MRI that showed my spine as well as my brain. And that's only because I asked for it. I kind of wish I'd known this stuff a little sooner. Well, hello and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam. I've been living with MS for over 40 years, and I'm currently halfway through my radiation treatments for my cancer surgery. And now so far that part's going pretty well. Can't say the whole thing is. Maybe I'll tell you a little bit more about that in a minute. But today I wanted to show you an article that I came across pretty recently about MS and spinal lesions and what kind of effect that has on our MS symptoms. Before I get into that, though, you might be wanting to know a little bit more about spinal lesions in general. So I'm going to play a couple of short video clips, one from Dr. Brandon Bieber and one from Dr. Aaron Boster.
We'll look at spinal cord lesions, and this diagram shows the general anatomy of the spinal cord. That information comes from the brain and branches off in individual nerve roots to different parts of the body. So lesions that are higher up in the spine can affect more of the body. For instance, a lesion at C1 could affect both the arms and the legs, where a lesion at T10 could only affect the lower extremities. Even a lesion at C8 wouldn't cause significant motor deficits in the upper extremities most of the time. We're actually looking at sensory innervation, but the muscles follow a similar pattern of innervation. So when someone has numerous high cervical spine lesions, as shown in this example, it's often linked to more disability. This is an example from a 32-year-old woman with secondary progressive MS. You can see there's a cervicomedullary junction lesion along with numerous high cervical spine lesions and thoracic spine lesions and a lot of lesions in the brainstem as well, a very abnormal MRI scan. This is another example with a few high cervical spine lesions along with lesions in the brainstem, and this is one more example where there are at least 3 lesions at C1, 2, and 3. And of course, high cervical spine lesions aren't always associated with significant disability. There may not be that tissue damage. If there is a lot of demyelination, there can be a lot of remyelination and preservation of the axons, but it's on the average associated with more disability.
So spinal cord lesions are one metric which would suggest a more significant prognosis or a higher risk of disease progression if you have cord lesions. So not having any cord lesions, particularly at the time of diagnosis, is prognostically a good thing.
Okay, having looked at all those, let's go ahead and look at the article now together. This article came out a few months ago, January of 2025, but I just saw it recently in April, and it's from my MS team. 4 symptoms caused by MS spinal lesions. How common are they? They say that in multiple sclerosis, lesions develop in the central nervous system, which includes the brain and spinal cord. As many as 80% of people with MS develop spinal cord lesions. Depending on where they form, spinal lesions may play a role in which MS symptoms you experience and even help doctors better predict your disease progression. In this article, we'll explore how MS causes spinal lesions, which symptoms they're associated with, and why monitoring them can be an important part of managing your MS. What causes spinal lesions in MS? In MS, the immune system mistakenly attacks the myelin sheath, the protective coating on the outside of nerve cells in the brain and spinal cord. This damage leaves behind scar tissue that forms into lesions called plaques. And I've seen many a time on my own MRIs all of the plaques and demyelination evidence that is going on in my brain. But I did not know until fairly recently, as I said, that I also had some things going on in my spinal cord. They say that MS spinal lesions typically form in 2 main areas of the spinal cord. The cervical spine, about 60% of MS spinal lesions develop in the neck or first 7 bones of the spine, or the thoracic spine, lesions can form at the base of the neck down through the mid-back. And they remind us that other conditions can cause spinal lesions, and among those would be neuromyelitis optica, acute transverse myelitis, lupus, or infections such as Zika or tuberculosis. Doctors use a process called differential diagnosis to rule out other diseases before diagnosing MS. This means they check for and eliminate other possible causes of your symptoms to make sure MS is the correct diagnosis. And for some of us, that takes a long and very frustrating time. Now, here's the meat of the article that got me interested. It says, what symptoms do MS spinal lesions cause? Spinal lesions can cause a variety of symptoms depending on their location and how severe the nerve damage is. Here are a few of the common symptoms often connected with spinal lesions in MS. Number 1 is walking difficulties. More than 25,000 members of my MS team report experiencing walking difficulties. Some days, walking, standing, or even sitting is a chore, wrote one member. When I walk with my cane and see people who are walking and looking at stuff on their phones with ease, I get envious, said another. I don't know, yeah, envy might be the word, I suppose, if I were totally honest, but to me it's like a marvel. I look at that and I think, I used to be able to do that. What happened? And I guess I had not really understood that the spinal damage is probably part of the reason I'm having trouble with my walking, because it seems to flare more. I mean, it seems to be more dependent on factors like my general health, if I have a cold or some kind of infection, or if I'm tired, or if it's too hot. It does seem like walking gets affected almost immediately, and that may have a lot to do with the location of the lesions that I have on my spine. Number 2 is closely related to that, coordination problems. Problems with coordination can take many forms. More than 32,000 members have reported trouble with balance, and more than 10,000 have experienced tremors. Like other MS symptoms, coordination may get worse due to hot weather, infections, or other triggers. Temperature changes make me fall and be uncoordinated, or I can't think, shared one member. I have a cold, so I'm a little more uncoordinated, wrote another. Number 3 is bladder issues. More than 23,000 members of my MS team have reported a range of bladder problems, another common symptom of MS. Some report incontinence. We can all leak, said one member. I'm unable to empty my bladder, replied another. Full bladder and can't relax enough to pee, someone else said. Yeah, I think a lot of us could probably relate to some of these episodes, and it's interesting to know it's not so much the damage in our brains, so that may be very extensive, but a lot of these things are tied to the lesions on our spinal cords. And finally, number 4, they talk about bowel dysfunction. Bowel problems are reported less frequently than other common symptoms of MS spinal lesions. More than 11,000 members have reported issues with their bowels. I'm having problems with my bowels and I hate it, stated a member. Another reported, bladder and bowel issues need constant attention. And I will say, yes, when you're having these kinds of problems, nothing in life seems as good as it could be. It drags you down almost faster than anything else. I'm going to totally admit that. And then they discuss spinal MS versus brain MS. Not all MS lesions cause noticeable symptoms. Compared with brain lesions, spinal cord lesions are more likely to cause symptoms. Those symptoms are also more likely to linger after relapses, also known as flare-ups, because the spinal cord isn't as good at compensating for damage as the brain is. So I guess when we're talking neuroplasticity, the brain is a master at that. I don't know that the spinal cord is anywhere near in that league. As they say, some my MS team members have asked, can you have MS lesions on the spine but not the brain? The short answer is yes, it's possible. However, MS can't be diagnosed if just the spinal cord is affected, so you'll need to follow up with your doctor to see how these lesions develop. And so how are these lesions detected? The most common method for detecting MS lesions is through MRI, magnetic resonance imaging. Recent advancements in MRI techniques have allowed for higher resolution scans that better detect small abnormalities in the spinal cord. Your doctor may recommend injecting gadolinium during spinal cord MRI to help identify active and inflamed lesions from immune system attacks. They discuss spinal lesions in MS progression, a topic that we're all interested in. Lesions on the spinal cord can tell doctors a lot about how your condition may progress over time. Some people have signs of MS visible on MRI, but no symptoms of MS yet. Among those with spinal lesions are 64% of people later diagnosed with clinically isolated syndrome or relapsing remitting MS, and 100% of people who are later diagnosed with primary progressive MS. And they say that among people with CIS, those who have spinal lesions, and especially multiple spinal lesions, are more likely to get a diagnosis of MS and more likely to develop a disability. In people already diagnosed with MS, those with spinal lesions are more likely to have MS relapses, develop disability, need to switch disease-modifying treatments to more effective options. This is similar to what Dr. Boster was talking about, that if you are diagnosed with MS and the spinal cord lesions are visible right away, your chances of having a more severe course of disability are greater. They have a section on preventing new or worsening MS lesions. Although there's no cure for MS, several strategies can help prevent new lesions or slow their progression. Disease-modifying therapies tops that list. The U.S. Food and Drug Administration has approved more than 20 disease-modifying therapies that can slow the disease progression of MS by reducing both the number and severity of relapses. Other MS medications are geared toward easing symptoms instead of stopping the progression of the disease. DMTs work in a few different ways, including these. They can reduce the amount of certain immune cells involved in MS attacks, they can regulate immune cell function, or they can reduce inflammation and demyelination. And we've seen that with some of the ones we've looked at in more detail, that they tackle different aspects of multiple sclerosis. A 2024 study found that high-efficacy DMTs are increasingly effective in reducing new brain lesions and possible relapses. However, the study did not find enough evidence that high-efficacy DMTs reduce new spinal cord lesions. Interesting. Okay. Further clinical trials focused on DMT effects on new spinal cord lesions are needed. I would agree. Yes, that's an interesting divergence there. Why would the DMT be effective in one area but not another? Interesting question. Work with your neurology team to find a treatment plan you can stick with. That may include DMTs to slow progression and other medications to manage MS symptoms. If you're still experiencing relapses or worsening MS symptoms, despite taking a DMT, it may be a sign it's time to talk to your doctor about switching. The last piece we'll look at here, they have just some words on regular monitoring, the importance of that. Regular MRI scans of the brain and spine can help track lesion progression and guide your treatment plan. This ongoing monitoring lets doctors see if any new lesions have formed or if current lesions have changed, so they can make adjustments to best support your health. And that might be something that you can talk with your doctor a little bit more about. As I said, I had to ask to get the spine included in the MRI. And I think that maybe doing that in a more routine basis might be useful, even though I would have considered my MS pretty stable. As I see now, my symptoms are really actually more affected, or at least the ones I notice, are more affected by what's going on in my spine, I think, than in my brain. So why wouldn't I want to know how the spinal lesions are progressing if they are? Okay, yeah, you can see why it would have possibly been helpful to know this information sooner. When I got the MRI of my spine, it showed that I did indeed have lesions, but we didn't actually discuss that a lot when I met with my neurologist, and I think I'm going to do a little bit more digging into this next time. I'd kind of like to understand a little more about exactly where the lesions are, because as you noticed, Dr. Bieber said that if they're below a certain level, you're not going to have problems with your arms, but you're going to have problems with your legs. And I have a feeling that might be true for me, because MS for me seems to vary most when it comes to my ability to walk well with any kind of strength or coordination or endurance. And that all does kind of seem to be related to what the article is saying about spinal lesions. A couple of weeks ago, when I was taking the experimental drug as part of the clinical trial, I was doing just fine. And then one day I found I couldn't even stand. For like more than 24 hours, I could not get up out of bed. And until my husband was able to find me a wheelchair, I was kind of stuck. But that's typical for me with any kind of infection, or I had COVID one time, it happened, because MS to me is kind of like the canary in the mine shaft. Whenever anything really goes wrong with my body at that level, it's like MS feels that it has to put all of its resources into tackling whatever that thing is. And hey, you don't really need to walk. I think I need to be doing this other thing. Thank you very much. But in a way, I guess I should be thankful, because really, a lot of times I don't even know that I have anything majorly wrong, except that I suddenly can't walk, which kind of gets your attention. And I think that might be the point. Well, now I'm off that medicine, and for good and all. And they're monitoring me like crazy, because apparently it has had some effect on my liver enzymes. And by the way, I noticed in this video, I look a little yellow, but I swear to you, I don't in the mirror. And I took a selfie with my smartphone, and I don't look yellow there either. So I don't know what kind of cruel joke this is, but anyway, be that as it may, I assure you, I don't have jaundice. I don't have many of the symptoms that they talk about possibly being representative of imminent liver failure, but they are very, very concerned about it. And I guess I have to thank MS in its weird kind of way for doing its part to get my attention, because I might otherwise not have noticed. But I do think all of this is very interesting in terms of how the lesions on our spinal cord actually play a bigger role in some ways, especially with our MS flares, or with environmental conditions like temperature that can cause us to flag or not be able to coordinate, not be able to function like we want to. It's not just what's happening in our brain. As they pointed out, there's more neuroplasticity going on in the brain than there is in the spinal cord, so you don't have as much resilience there. And when something hits, it doesn't really rebound the way the brain can do. And so, what can we take away from this? Well, we have to keep our general health as high as we possibly can, of course. And we need to go to the doctor and make sure, if you haven't had an MRI with your spine included, make sure you do, and ask if there are lesions, where are they located, and what effect they might have on your MS symptoms, because understanding helps with the frustration quotient, if nothing else. But that's all I have for you today. So until the next time I see you, you have to take really good care of yourself. I'm seeing that as so important given everything I'm going through at the moment. I will see you again in my next video.